Well, keeping along with health news, GLP-1 medications like Ozempic and Wegovy have surged in popularity, helping people lose weight and manage diabetes. But now, after several years of widespread use, doctors are starting to get a clearer picture of the longer-term effects, from digestive issues to muscle loss to questions about what happens when patients stop taking them. There's a lot people want to know. So joining us now is Dr. Sonal Harder from Dignity Health Medical Group, and Sonal is also a board-certified obesity medicine specialist. Great to have you here. Out of the gate, I want to go over exactly the GLP-1 medications that are approved by the FDA for weight loss.
Okay.
What are those?
So we have three of them: liraglutide, which is known as Saxenda. We have semaglutide, which is known as Wegovy. And actually, people know this medication as Ozempic, but for weight loss, it's actually Wegovy.
Yes, because Ozempic is more geared for those with diabetes.
Correct, you're
Okay.
correct. But it's semaglutide. And then tirzepatide, which is Zepbound for weight loss. So those are three that are FDA approved under this category for weight loss.
Okay, so let's talk about the side effects, because it is a little long, the
Right.
list of side effects. So
Right.
what will people experience, or could they experience from these drugs?
So the most common side effects, Tram, are actually gastrointestinal symptoms. About 10 to 50% patients experience this. Common nausea, diarrhea, and constipation. And then in severe cases, which is again very, very rare, but you can get intestinal obstruction or gastroparesis. But there are some other common side effects like headaches, chronic fatigue, dehydration, hair loss, and sometimes gallbladder stones or gallbladder inflammation. In very rare cases, pancreatitis. And the one that actually people don't talk about often, although very, very rare, vision loss. So this is something
Wow.
that people have to watch for.
Yeah.
Right? And I would not consider muscle loss as a side effect of these medications, because muscle loss actually happens with any weight loss process. In fact, abrupt weight loss can result in muscle loss. And this is where it can happen from weight loss surgeries, it can happen from other weight loss medications. They're not exclusive to these medications. These medications result in very effective weight loss. And hence, if you're not combining that with resistance training, eating enough nutrition, you see some muscle loss in these medications.
Yeah, because a lot of people, they lose the weight and they think, oh, I don't have to work out.
Correct.
So they skip the gym and they don't try to build that muscle regardless of your age,
Correct.
right? And it's even more important as you get older.
Absolutely.
Yeah.
One other side effect that I watch for in my practice is mood changes. Sometimes patients will come and say, I just don't feel excited. And that's that reduced desire for food and cravings and hydration. So something to watch for.
Okay, so let's talk about what people can do to try to minimize these side effects.
Correct. So start with actually breakfast. I like your previous segment that was
Yes.
focusing on breakfast that includes protein and fiber. Understand the difference between feeling full and nausea. Those are two different things. Nausea is an uncomfortable feeling. Feeling full is a good satiety.
Okay.
So just know that there's a difference between that. Eating at regular, like frequent intervals, like 3 to 4 hours, smaller meals.
Okay.
Staying hydrated with water. Reducing carbonated drinks, because these can actually irritate your stomach. I say with alcohol consumption, no to minimal.
Okay.
So if you like to drink occasional alcohol, keep it at minimal, like no more than 1 to 2 per week, because alcohol doesn't pair very well with these medications.
Wow. Okay.
Right. So I think those are some of the common. And then if you have peppermint or ginger teas, those are good for some nausea. And in extreme cases, I also recommend making sure that you get nausea medications from your doctors.
I've heard a lot about the hair loss
Yes.
and how bothersome that is for
Absolutely.
so many people. What can people do, if anything?
This happens if you're not consuming nutritious food and if your calorie count is really, really low, because you lose that protein that we need for hair follicles. So what I advise my patient is you will not crave for certain foods, but we have to make sure you're eating good nutrition every 3 to 4 hours that has protein, fiber, green vegetables. When you maintain those macro and micronutrients, your hair and your skin continues to actually thrive even with these medications.
I also saw on that list too that avoid, fatty foods. Of course, that's kind of a rule of thumb, right? In general, but in this particular case, why is that so much more important?
Specifically with these medications, fatty foods and spicy foods can aggravate your gastrointestinal symptoms like nausea, vomiting, and diarrhea. And hence, to avoid processed foods foods, high sugary foods, these can actually give you more of these side effects than normal. So I would say, like, stay close to nature's food, which is vegetables and fruits and fiber, lots of hydration, 2 to 3 liters of water. People often don't crave for water on these medications, so get dehydrated. So I think just to put that on your schedule to drink water as well.
It seems just bottom line, no matter what, whether you're losing weight or not, you got to eat healthy and you got to exercise.
I think that's one. I always say
basics.
this. The 2 arms of weight loss is medications. Of course, some patients need it, but also your good lifestyle is actually going to support. And also, some patients have a good chance of coming off these medications if you're maintaining that active lifestyle and good nutrition.
All right. Excellent, excellent advice. Thank you so much, Dr. Sonal Hodder. We
Thank
appreciate you.